for your guidance during the efforts that our city has had to make, all these months of COVID. And may we continue to cooperate and see the downturn and the safety and protection of all people. I pray for this meeting, that a blessing be upon our mayor and all of the council people, that you lead and guide them with the considerations, the decisions, whatever they may need to hear one another and hear you, God. Continue to always pray a blessing on our world, our country, and our own area. And lastly, God, for all the people who grieve and mourn the death of, especially those who have died through COVID, that you touch their hearts with your comfort, as you touch ours with the courage and endurance to carry forward. We pray this with our belief in you, our God, and in your Son, Jesus. Amen.
Amen. Thank you, Dadelyn. We always enjoy having you here. We appreciate the time you commit to come and do this.
You're welcome. Thank you.
The next item on our agenda today are some announcements regarding employee promotions. So I'll hand it to the city manager.
All right, Mayor, thank you. We have a number of promotions to announce. And typically I don't make a lot of announcements for promotions unless they're director, sometimes assistant director level positions. Well, I got 4 of them for you today. First, Blair Snow has been promoted to assistant director of finance. She'll be working directly for Debbie Reed, who is our new director of finance. So some key positions there. Blair is going to be leading a team that's responsible for creating and managing our city budget. It's a key position because our budget's a big budget. We've vacillated between just over 400 million and this year, just below 400 million for the last few years. So that's a big deal. It's been with the city since 2010. She started as a management analyst for the city manager's office, worked in public works as a program manager, bachelor's degree in accounting, master's degree in business administration, currently obtaining her CPA. So good ad for us. Looking forward to the good things she's going to do with finance. Also, Victoria Medley has previously was our director of municipal courts, but she has been serving yeoman's work for the last 6 months, approximately 6 months, as working over in animal management. And she was very clear that this was not a career move for her. She was just wanting to help out because we needed help over there. We were real short on staff. And she has grown, I think, I don't want to put words in your mouth, Victoria, to love the team out there, to love the mission. She's certainly an awesome fit out there. Well, I got off my notes. She previously served as director of court administration for 19 years. Court Services has been serving as management advisor for animal management since August. She's taken the lead on a number of key initiatives at animal management, online reporting system, updated field officer training, implemented managed intake for the public, she's in charge of the renovations and the upgrades out at the animal management. If anybody's been out there and seen the new administrative offices and the new surgical center that we have out there, it's going to be a huge add to the effectiveness of what we can do, and the quarantine space for animals. It's going to be a huge add to what we can do. Once we get fully up and running, no animal is going to come out of that facility that hasn't been spayed or neutered. And that's one of the biggest challenges we have here in the city of Amarillo is the number of unaltered animals in our community. So she's been a big leader on part of that. She's going to replace Rob Sherwin, who's been serving as the interim director out at Animal Management. Rob's done a great job. He'll be with us physically through the end of the week, and he'll still be participating in meetings and other things via Zoom and remotely for a period going forward after that. So we're going to benefit at Animal Management under Victoria's leadership. We have a great team out there. I was talking to that team this morning. I'm really excited about what's happening in Animal Management right now. And if anybody has any questions or comments for Victoria, for Blair, or for anybody else we talk to, please feel free to jump in and interrupt, and I'll stop while y'all make whatever comments you have.
I want to jump in really quick on Victoria. I think we couldn't have had a better person step into that position to be the director of animal management and welfare. She is such a solid person and can do such a good job. I would almost call her Midas. Whatever she touches can turn to gold. She does such a great job. I'm excited for the direction that it will take animal management and welfare. I think this is what we've been looking for to help just completely recreate that whole situation out there, reestablish relationships, and the end result is going to be the animals and pets that are here in Amarillo are going to be in a much better position because of what she's able to do out there. And I darn sure don't want to forget about Blair. Watching Blair since I've been on council and the different things that she stepped into, she is a multi-talented person, and I couldn't wish any more for her. And I'm really grateful to see her moving up the ladder. She does such a great job.
So I just echo Council Member Sauer, but I'm so excited for both of the ladies to have this opportunity. So awesome team, and I know that they're going to do well. So I am so proud of both of them.
Well, I've got two more biggies, so y'all feel free to keep on jumping in. If there's more that want to comment on Victoria or Blair right now, you can also comment later if you want to. But Victoria moving from courts to animal management, Victoria, if you want to turn on your camera, I'm gonna say something that's kind of embarrassing for you. One of the things that she's most excited about out there is she caught me and said, "You know what I love about working out here? I can wear tennis shoes."
It's true. It's true. 19 years with heels in court. So yes, it is.
Also, because Victoria has moved over to animal management, that creates an opportunity out at municipal courts. One of the things that Victoria and her work over at courts, she's also been working very closely with her team there. And we didn't have to look far to find the next director of court services. Donna Knight is moving into that director's role over there. And I should say we're immediately at Animal Management. We have already begun the process of interviewing our candidates for assistant director out there. So we will have director and assistant director, both positions filled in relatively short order. At the same time that we're getting closer and closer and closer to being fully staffed out at Animal Management. So lots of exciting, positive things going on there. Great. We're working to really build up our relationships with our rescue community and rescue operations, make sure we've got healthy, functional, effective relationships, and that we're enabling them to be effective by providing them animals so that they can do their mission. We want them to be successful, and that's something that's been happening under Rob and Victoria's leadership. So I'm real excited about what's going on in animal management. On court services, Donna Knight's been with us for a while. She's been working with Victoria. We didn't have to look far. It was a very obvious choice as we started deciding. Well, once the dominoes started falling, once we moved Victoria over to animal management, we wouldn't have done that if we didn't have a high level of confidence in the people that would be filling the gap that Victoria leaves over at court services. Donna Knight is that person. She's been with municipal court since 2012. She promoted to assistant director of court services in 2014. So she has a lot of experience working directly under one of the most recognized court administrators in the state of Texas. Victoria was one of 3 court administrators that would train new municipal court judges in how to work with the municipal court system. So she is a big deal in her profession. She has trained Donna to be able to be that same quality of service. So we're really excited. I had a conversation with Donna earlier this morning. Really excited about what she's going to bring to this role. Donna, wave to us. There she is. Most recently, Donna serves as interim director of court services since Victoria's been on assignment out at animal management. She has broad knowledge, leadership skills. I know she's going to do an amazing job. So please join me in congratulating Donna on this new role and this new opportunity.
All right, Donna, congratulations. And Victoria, don't forget to wear your pearls with your tennis shoes.
And you know that.
Finally, we have it sounds like a broken record. I'm really excited to announce, so I'm not going to overkill that. But Donnie Hooper is being promoted from Assistant Director of Public Works to Director of Public Works. He's got decades of experience in public works. He succeeds Raymond Lee, who has moved on to another opportunity in Colorado. Really excited about that. About the opportunity he has in front of him. And Donnie first started with us as Assistant Director of Public Works in 2018. Prior to joining us, he had been the Director of Public Works for the City of Pampa, where he spent 22 of his 25 years in public service. He's got a proven and very impressive track record of leadership and experience in public works. He's been doing a great job with the City of Amarillo. He's presented a number of projects to the City Council. And he's got a number of very high visibility projects that he's responsible for. So it's an opportunity for Public Works to really shine right now, whether we're talking about illegal dumping enforcement or cleaning up our alleys or any of the other projects that he's responsible for. I'm excited to see how he moves Public Works forward as in the future. So finally, again, please join me in welcoming Donnie, but not just Donnie, but also Victoria, Donna, and Blair.
All right. Congratulations, Donnie.
Now, we're also filling that position, the Assistant Director in Public Works position, in an expedited manner, but we're going to be conducting interviews and posting and seeking applications for that job. So they'll be a little bit behind what we're going to see in animal management, but probably along the same lines as what we're going to see in municipal court.
Thank you.
Mayor, I just wanted to congratulate all those individuals on their promotions. And at the same time, I just wanted to give a shout out to you, City Manager, and that I do think that one of your great skills is identifying abilities and skills in your staff and shifting those around and being willing to move people out of maybe lanes where they have been in and not just stay on one track. And so just appreciate you recognizing these individuals and the opportunities for them to move to different positions.
Thank you. I appreciate that. It's a team effort. We've got a lot of good people in here, and it makes it a little easier when, to find the right peg to put in the hole when you got such great resources.
Well, I echo that. It is very satisfying to see people who are already in the organization performing well. And you affirm that, Jared, by finding a spot with more responsibility for them. And I agree with Councilwoman Hayes that you're really good at doing that. But congratulations to the four of you, and thank you for the service that you've given the city. We look forward to, with your new responsibilities, just that continuing and seeing you have more success in your new roles. Stephanie, do we have anyone signed up for public address?
Mayor, we do not have anyone signed up today.
Okay, thank you very much. So we'll move then straight down into the agenda on item 1A, reviewing your packets. Any questions, council, on the information you received right up front? Anything you need to clarify or get more information on? Okay, let's move to item 1B, a coronavirus update. Mr. City Manager.
Right, Mayor, we have quite a bit to report. We've had a change in status. We have a dropping hospitalization rate, but we also have a desperate need to continue staying vigilant with our face coverings. As our hospitalization rate is dropping, so is our hospital capacity as the RAC draws down some of the nursing assistance that we've been provided over the last handful of months. To reallocate those people to some areas that are in much worse situations than we are, that's going to bring down our hospital capacity. So we need to stay diligent. I wanted to start with that message. We have to stay diligent with our face coverings, even though we are doing much better. Our community, and it's because of our community's work, hard work, diligent work to wear their face coverings. So I've said too much. Casey, go ahead and take it away, and then we'll be able to answer any questions that council might have.
Yes, thank you, Jared. I appreciate that. That's always a great message. So as of today, there are a total of 32,594 total cases of COVID-19 reported in Potter and Randall County, 16,644 cases in Potter County, and 15,950 cases in Randall County. We have a total of 30,175 recoveries, and we're up to 651 deaths here in our community. That leaves us with 1,768 active cases, and each of the cases do represent a unique individual. The rolling 7-day positivity average for Potter and down to 4%, and that's truly amazing. And the positivity rate at the drive-through testing site, which is a subset of that total, is at 22%. So just right around a quarter of the people who are coming to the drive-through testing site are testing positive. And the 5-day new positive case average is down to 2 new cases per day.
How many?
Yesterday, 72.
Okay, I'm sorry.
No, you're good. I appreciate that. Yesterday, our GA32's hospitalization percentage for our Panhandle RAC region was at 9.84%. So we haven't been down below that 10% mark, I believe Mr. Starbuck said, since September 28th. So truly a really great thing. That 9.84% means that just 9.84% of all of our hospitalized patients have COVID-19. Our RAC is no longer considered an area of high hospitalization. However, it's critical that we continue to wear our masks, social distance, and have good hand washing, as our hospitalization rate and our infection rate are fragile and depend on the choices that we make to remain low. Our local hospital capacity has eased up a bit, with just 65 patients hospitalized with COVID-19. Adult bed utilization is at 74.5%. ICU utilization is at 68%, and ventilator utilization is at 33%. The hospitalization rate is at 3.68%. And that means that 3.68% of all of the people who have active COVID-19 currently are requiring hospitalization. Locally, however, we're still in status level red. We did reissue a status level red last Wednesday for another 2-week time period, as 3 of the 4 indicators were in that status level red threshold. We will continue to monitor the indicators and issue another status level as appropriate next week. So we'll reissue another status level based on those indicators that we set in October. And so if the indicators allow us, then we'll move to orange, and if not, we'll stay at red for another 2-week time period. While the status levels don't track directly along with the state's designation of high hospitalization, they do work nicely together. The status level, like right now being in status level red, reminds us that we're not out of the woods yet. And while our numbers are trending in the right direction, it's up to us as a community to continue to fight COVID-19 by practicing those public health prevention measures that we all know and love at this point. Public health operations. So the public health drive-through does remain operational. You can call 378-6300 to be screened and directed to the test site. The outpatient bamlanivimab infusion center is open. We're seeing patients based on referral. And to date, we've seen 128 patients and only 4 have required hospitalization. So a really great response there. And on the vaccine side, Amarillo Public Health, along with all of the departments supporting the operation, are still giving vaccine. The Civic Center is open today, and we're giving lots of vaccine. So as of yesterday, we had given a total of 33,095 first doses and 13,175 second doses, for a total of 46,270 doses given of the received 61,950. This morning, we started the day with 2,155 first doses, and the second round of second doses, as we did receive another 10,000 second doses this morning, right around 10 o'clock. We appreciate the VA. They supplemented our staff with 500 second doses so that we could start the morning off with second doses available to the community. Of the data analyzed, which has been certainly a good representative sample, 82.8% of the vaccine given has gone to people who live here in Potter and Randall counties. 96.4% of the vaccine given has gone to people who live in the Texas Panhandle, and 3.6% of the vaccine has gone to people living outside of the Texas Panhandle. We have had good uptake on second doses as we've given everything that's been shipped to us, except those two, that we have new 10,000 doses this morning. But as of yesterday, we'd given everything that had been shipped to us. Like I said, we received our next shipment this morning, and again, we appreciate the VA loaning us those 500 doses so that we could get the morning started before our shipment arrived this morning. And always want to remind everybody, when you come to the clinic for your second dose, remember to bring your shot record back, your little card that you got, so that we can document your second dose. And I'm happy to answer any questions that you might have.
Yes, Casey, I have 4 questions for you.
Okay.
The first one is, do we know when teachers will be able to receive the vaccine? And I guess this would just be individuals without underlying conditions.
So the state, the EVAP committee, the expert vaccine on allocation, the expert vaccine allocation panel has not taken up the topic of 1C or 2. So we don't know that for sure. We don't know that. That hasn't been discussed yet, when the next group of people might be able to receive vaccine. But certainly if there's a teacher who is in that high risk category, 65 or older, or who has a chronic health condition, they can receive that vaccine now. But people as an occupation group, that has not been decided at the state level yet.
And I think it's important to add to that. Mayor, go ahead.
Jared, you go ahead, and then Frida, we're going to come back to your questions. We're going to pause for just a second on those criteria. Jared, you want to make your comment?
I may be stepping on your comment, Mayor, but I was just going to say, we've had requests. Why can't we vaccinate our teachers? Some other jurisdictions in Texas are vaccinating their teachers. We don't know by what mechanism they've been able to do that. What we do know is that that's vaccinating people outside groups 1A and 1B is not consistent with DSHS and governor's orders. We want to make sure that we can continue to be the most effective vaccination site in Texas, and doing things outside the guidelines would jeopardize our supply and indicate that we have completely addressed our 1A and 1B populations, and that is absolutely not the case. So it's imperative for us to continue to follow the governor's and the DSHS guidelines regarding vaccinations. And that's why it's not because we don't want to vaccinate our teachers. But that is absolutely not the case. It's just that we're not empowered to do so. We don't have the authority to do that at this time.
Casey, can you take a moment just to go through those? What are the underlying medical components to belong to the 1B class of people who can get vaccinated?
Yes, so the list that was published, and it says it's not an exhaustive list, but the conditions are like diabetes, heart disease, COPD, obesity. So if you have a BMI over 30, then that would certainly be a high risk condition. It lists pregnancy as a chronic health condition, although we know that chronic health condition doesn't last forever. We know, and so there are a number of those types of conditions that are on that list. However, it says that the list is not exhaustive. And so the way we have phrased that is that if a patient and their physician believe that having COVID-19, or that their condition, if they got COVID-19, would put them at risk for very significant consequences, then their high risk condition would qualify. So we have a number of people ask, does my condition qualify? And if it's not specifically listed on that, in the list of conditions that are examples, it would be, something like an immune deficiency, or, something that would lower your immune system, or something that would put you at risk for COVID, then it's something to consider. But the conditions such as diabetes or heart disease or COPD, chronic lung disease, chronic kidney diseases, those types of conditions are what are specifically listed, but it does say that the list is not exhaustive.
And Casey, just the procedure for when someone comes to the clinic to get their first shot, what I observed is that there is a staff member that greets them and welcomes them at the door. We have a large sign up on the door that kind of lists the basic categories for a 1B condition. And that staff member, after they say hello to the person, they say, do you meet any of these criteria? And if the person answers yes, then they come on into the clinic for their shot. Is that the procedure that people should expect when they come to get the vaccine?
Yes. And, we are asking for people to be honest. They, if they have a chronic health condition, you don't have to tell us your whole life story or, reveal all of your medical conditions to our staff at the front door. But we do ask that you're honest, and that if you don't have a chronic health condition, save that dose for somebody who does. But the reason that the EVAP committee went that direction is because in a pandemic, you need your healthcare workers. And so that's 1A. And then 1B was listed out specifically because that's who has been significantly impacted and who is, dying from COVID. And so that was the 1B and the 1A groups that needed the vaccine the most at this right now, when there's just not a robust supply. And so as our supply chain increases, and as when there is more vaccine available, then those groups will certainly increase. But right now, we're asking people to be honest. And if they do not have a condition that would put them at high risk for a complication of COVID-19, that they save that dose for someone who does.
And so, Frida, back to your questions, until we get different or better communications from DSHS about that teacher question, I just want us to be communicating with all teachers about what those criteria are. The sensitive one, I'll just say it, I think, maybe it's just because I'm a girl, is the body weight factor. I have seen people come to the clinic, and when asked the question, they walked away because they didn't have an underlying health condition, but yet I think they probably met the BMI of 30 condition. And so I just want to encourage folks to, it's real easy. If you want to intellectually know, just Google a BMI calculator. But if you fit one of those criteria as a teacher, we want you to come and get a shot. And there are many of you who do. So look closely at what those criteria are.
And Mayor, we have some BMI charts at the front door. And so if somebody is curious, we're happy to let them, and we don't ask, we don't make you say, yes, my BMI is over 30 or my BMI is whatever number it is, but because we want to certainly be respectful, and we want to be, and not that it's okay if your BMI is over 30, like that's not, but you don't have to say it is all I'm saying. You don't have to say if you have diabetes or if you are pregnant. Like we have plenty of people who are pregnant that they just, it's not our business. Like we just want to be respectful. And so, but we do have a BMI chart. And so if somebody comes and they are, they just need that confirmation, then we do have that resource available for them that they can discreetly just look it up and then say, yep, I qualify, or I don't, I'll come back when it's my turn. And so we certainly want to serve people.
You're not weighing people, and they don't have to come with a doctor's letter that lays out their conditions, or I just want to have a very open conversation about what they can expect when they come to the clinic and have to talk about their conditions.
We're definitely staying within the bounds of the 1B and 1A criteria, but we're asking people to do so in a very respectful way.
Okay. Councilmember Powell, thank you for letting us go down that road to your very good question.
And I appreciate that detailed information because our citizens need to know that, and they need to hear it. So thank you for that. My second question, Casey, is in regards to those individuals that are homebound and maybe they are receiving Meals on Wheels. Are we maybe close to maybe finalizing a process of how we would get the vaccine to those individuals?
We are working on that, and we're internally working through processes. One of our other problems is that we just run out of vaccines so quickly, like the first doses. And so, again, it all hinges on kind of that supply and demand, but we're certainly working through those processes internally, and it's definitely our goal. We want to do that, and we want to do that well. We need to be able to have a secure amount of vaccine, and we do run out very quickly. And so that was the long answer. The short answer is we're getting closer, and we're working on the processes there.
Okay, thank you. My third question is in regards to herd immunity. When do we think the Amarillo community will reach that point? Is there like a percentage of vaccines that we're targeting?
So, we've heard that the number of the percentage of people who need to be vaccinated is likely anywhere between 60 and 80%, maybe even closer to 85%. According to the COVID Act Now website, we're around 13.1%. We're certainly doing a good job there. We have a ways to go. And so, again, we need more vaccine. We can certainly prove that we can put shots in arms. And so we will continue to do so, but we need to hit that 60 to 85% mark, likely closer to the 85%.
Okay, thank you. And my last question is, so we've had lots of individuals that have come from out of town to receive the vaccine for different reasons, and so they may be coming from Colorado, they may be coming from New Mexico. I've even heard Mexico, as a matter of fact. Can you speak to that? I know that we're not turning away individuals that need the vaccine.
Yeah, so one of the criteria to be a hub, one of the things that we agree to is that we will not turn anyone away due to residency. And so that is one of our obligations that we fulfill as a hub. We do have people come from out of town, but a very small percentage. So only about 3.6% of the vaccine has been given to people outside of the whole panhandle. So definitely the majority of the vaccine, like the vast majority, almost all of the vaccine, like 96% of the vaccine has gone to the Texas panhandle. So we're definitely vaccinating people here at home.
And I want to add to that too. We have done a lot of work on social media and other mediums to make sure that our immediate population knows when we're giving vaccines and when we're not, when we have vaccines available, when they can come on down and get one, and also as quickly as possible, make sure that people know when we're out, because that happens too. We are not advertising outside our jurisdiction. We do not get paid anything for doing vaccines. These are all things you see on social media. So there's a lot of stuff that you have to winnow through, when you're utilizing social media. And there's a lot of just not things that aren't accurate. So we don't advertise outside our jurisdiction. We do, and it's not even advertising. It's really just making people aware of how they can get a vaccine, because we are entrusted with getting shots in arms, and that's our main priority. We are not advertising outside our jurisdiction. We're not getting paid for vaccinations. It's not a revenue center for us. In fact, it's a significant cost center for us. So just wanted to address some of those questions y'all didn't ask, but I know is out there on social media as well.
Okay. So Casey, thank you so much for your patience. That's all of my questions. Those are my questions for the year. So thanks.
So actually, you know what, Jared, speaking to that, watching the Super Bowl, New Mexico was actually advertising that they were giving injections whenever you're talking about us not doing it outside of our jurisdiction. I just remember seeing that commercial 2 or 3 times about New Mexico touting that they were giving the injection. So I think that's a valid statement. And actually, Casey, I'm really glad that you said that it was one of the criteria to be a hub was the fact that we would not turn away people based upon their location. I think that's really important. We need to let people realize and understand that. but also just as important is 3.6% of 30,000 doses is what, 900, maybe 1,000 doses have actually, vaccines have actually gone to people that are not in the Texas Panhandle. So out of 30,000, that's, I think you guys are doing a great job. I am just elated over looking at these numbers, and I write these numbers down every time we meet, and to watch how they have just precipitously fallen, especially since the first of the year. It's exciting to see that all of these numbers, especially that hospitalization rate, to fall below 10%. I mean, that is an incredible landmark for us to hit, and I am so grateful for everybody that has worked really hard to get us to that point. And that's really everybody that lives in the city of Amarillo or in the surrounding area. So I'm just really, really grateful. And I can't help but keep on saying, you guys are not doing enough BAM infusions. People turn up to be COVID positive and they've got a comorbidity. Don't wait. You need to get that done within the first 10 days. That's how you qualify for that one. And it is having a substantial effect on keeping people out of the hospital. And so I just got to go back to that one and do it over and over again. I mean, I keep running into people that I've talked to that have done that very thing, and it has made a substantial difference in the way they recover. So another shout out. You guys are, I'm grateful that you, Casey, that you all have made the effort to make for sure that we're providing that for the citizens here in Amarillo. It's a big deal. It's a very important deal. So thank you.
Other questions for Casey?
I've got one comment. Can y'all hear me?
Yes, sir.
Yes, sir, we hear you.
Thank you. I want to compliment Casey's mask. It says love is what it looks like from here. She and her team have demonstrated a lot of love to this community. We appreciate that. Also, I want you to notice that mask a little closer. From my viewpoint, it looks like she has a red nose. Rudolph the Red-Nosed Reindeer helping Santa bring all these gifts to all of Amarillo. Thank you, Casey.
Thank you, sir. We have a good team. And I'm absolutely ready for Valentine's Day.
Great comment. Casey, can you speak just a little as to what the city is doing intentionally to get the message out? Maybe we need to partner with the school district. We talked about teachers and getting the message specifically targeted to them. But I know we have targeted our communities of color because we want them to, statistically, it's showing that the people that are choosing vaccinations don't match the statistics for ethnic breakdown in our city, both from the Latino community and the Black community. Can you talk just a little bit about what we've done as a city to get the message to those communities, target them?
I can, yes, ma'am. And I will say that our statistics, so on the EVAP call, our statistics are very similar to the state's statistics. So this is certainly something that we need to work on here at home, but also we're right in line with the state statistics as well. But our work here at home is that we have had a conversation with the NAACP. We had a question and answer. Mayor Nelson and I and Councilwoman Powell served on that question and answer panel. And that had great questions, and it was a great opportunity to just visit and to answer questions that they had. This week we'll be doing the same Q&A, well, probably not the same questions. We anticipate, whatever questions come up, we'll answer, but the same format with the Barrio community. And so that will be on the 11th. If I get the dates wrong, anybody please correct me, but on the 11th at 6. And so we'll have a Q&A. It'll be Mayor Nelson and Marcus Nerios from our team. He is just a wonderful team member that we have. He's running our screening room right now. In his regular job, he does our HIV prevention team. And so he's just a really great person to have on your team. So Marcus will be there, and then myself. And so we'll offer time to just answer any questions that people in the Barrio community have regarding the vaccine and COVID. And then we have also sent out flyers in our water bills to everyone here in the Amarillo community. And we've also done targeted Facebook ads to our zip codes where we have lower uptake with immunizations. And so that has been very well received. A lot of clicks and a lot of traffic back into our website. And so we are just so hopeful that we'll have lots of participation from every corner of our community. We are, again, we're all in this together. We may not be in the same boat, but right now we are all in the same storm. So we want everyone to have an opportunity to be vaccinated. This is certainly not a matter of access. We have clinics open on Tuesday night until 7, and then the first and second Saturdays of the month. So if you have an opportunity to be vaccinated, then we certainly welcome you.
I would just add what a great job the communications team has done with their efforts to message it. I know there's still more out there for us to do. The Thursday panel is going to be in Spanish and English. So that's something important if you know a Spanish speaker and you think that it would be helpful to them to get their questions answered in Spanish. Thursday is the opportunity to do that. It is a Zoom meeting, and you can see that information on the city's website, or it'll be going up on the mayor's Facebook page, I know, before Thursday. Any other questions to ask about getting the word out in our city about vaccines? Okay, other questions for Casey?
I didn't have a question, but just to get a compliment on the efficiency of the way the system is being run. We have family down in Lubbock, and they were just discussing the process that either people have to call for an appointment or sign up, and just the logistics, the frustration of that. I know one family member called 500 times and still never got through, and eventually was able to get a vaccine through the VA. And so however that decision was made to have it open and just a walk-in clinic, I think has been a tremendous point of difference between why our system has run so efficiently. So compliments to however, and just recognition for the efficiency of how that's being run. And again, to the comment Howard made of just the other feedback I get, it's just not the efficiency, but it's the compassion, it's the kindness of all the staff. I think it has been an amazing, an introduction to a lot of people to our city, or from outsiders as well, of just a really putting a good face forward of who we are as a community. And so compliments to you and all of your staff. I wanted to follow up on something that Eddie said earlier, and it's still just the underutilization of the BAM infusion. And I'm just still so surprised in conversations that I have with people in the community that that don't know what to do if they test positive. You know, I think that people are getting good information on the vaccines, on different ways to try and protect yourself. But if those things haven't worked and you do catch COVID, just conversation after conversation, I think that we are still missing some communication opportunities and to get information about those early at-home treatments. And I would identify communication on basically every topic in the city is always our biggest challenge. And so it's not from lack of effort. I think it is just, it's always a challenge to get accurate information. And so on the BAM infusion, I want to follow up on that, Casey, with, the criteria for what qualifies somebody for that free infusion through the city. But if you don't qualify from that, there are other sources. And Eddie, you may be able to even address that as well, of just telling people if they didn't qualify through that, that you can, I think, go through your own personal insurance or your own personal physician to have that administered. And so I have one other comment to make, and I'll go ahead and make that one, and then if you guys could address that and answer that. The other thing with the early at-home treatments, for the last year, we haven't known a lot of things. A lot of the medical community hasn't been comfortable with a lot of the things that were unknown. All this has been brand new. And I just think it's very encouraging that the American Journal of Medicine did come out January 1st, their 2021 report, that they have listed some very specific at-home treatments based on age, on comorbidities. Part of that is a retraction of their lack of use on the hydroxychloroquine. The study that had been previously done that had raised concerns of that drug has been retracted. And so it's part of the drugs that are listed. It's not the only thing, and the combinations are very much dependent upon your age, your sex, and again, those comorbidities. And what my notes have is that it was page 18 out of that report, and it was a very detailed. Possibly if our public health department could review some of that information, see what we could be able to push out to continue educating people on the options that they have to lower that risk of hospitalization and possible fatality.
So I can talk about the criteria. Is very specific to the EUA, the emergency use authorization. And so the EUA is across the board. So regardless of which provider you're going through, they have to qualify based on personal risk factors, so age or chronic health condition, based on that EUA criteria that's been set by the FDA. So that's something that's just set by the FDA, and so providers will all use that same EUA criteria. They can, the bamlanivimab is certainly being used at the hospitals. I believe it's being used at some of the urgent care centers, but it would all be administered based on that EUA. As far as the early and at-home treatments, certainly this is a virus so there's not going to be a treatment per se or a cure. Certainly care would be supportive. So rest, lots of fluids. You can take, Tylenol, Advil as appropriate. Certainly, just treating those symptoms, certainly contacting your physician if symptoms don't improve, and again, seeking out that those monoclonal antibodies. If you're in those high-risk categories, we're always happy to review any material that is provided, but that certainly, with this being a virus, care would be supportive, certainly at home.
So Casey, can I make a comment kind of on that a little bit?
Yes,
so
sir.
Here's what I want to tell everybody about this, Elaine, is so this is a very unique time because, a lot of these, we really haven't experienced a pandemic of this magnitude in 100 years. And with the way we have social media and all the access now, what's actually happening is we are living out all of the trial and error that has gone on behind closed doors and actually goes on over a period of years before they develop, okay, this really does work, this really doesn't work, because they get to do these things and then turn around and look back and go, oh, that started out working, but it didn't work, or that didn't start out working, but it does end up working when we do certain things with it. And I think one of the biggest problems, which is going to be really frustrating for most of the public in general, is they don't realize that what's happening is right in front of their face is actually they're watching the medical community trying to work out this trial and error period of figuring out what's going on. And so they hear one thing, so they think that it's got to be gospel. Then 3 months later, now then it's not gospel anymore. So like the statement that Casey said, using ibuprofen and using Tylenol. Well, you know, when this first thing started out, guess what? One of the very first things they said, don't touch. That was ibuprofen. They thought that there was a big problem with ibuprofen, and now then that's since over this period of time, we finally found out, well, no, that really is not the case. And so I just think it's really difficult, and I still think time is going to tell for sure what's actually going to work and not going to work. And so it's going to take a lot of patience on everybody's part to let these things begin to play out and really begin to figure out what is working and what isn't working. And I'm just grateful that we've come across the monoclonal antibodies that have actually been extremely successful with this and finding out, oh, we can treat this early. And I think that's one of the problems that kind of came in originally, was everything was centered around what happens once they're hospitalized. And that's where a lot of things were not working, because it was all based upon really serious hospitalized cases. And now then we're beginning to see some things happen with different medications that go, okay, we need to be focusing on pre-hospitalization and keeping them out of the hospital. So it's been interesting to sit back and kind of watch and see what has been playing out in front of us that we usually would never see play out. Wouldn't you think that's probably the case, Casey?
Absolutely. That's a great description.
But Eddie, one of those things is that we are a year into it now. And, you know, a lot of those things have been now. We do have information. And that is why I wanted to bring this up, because where there have been some reversals, there were some, because we didn't have information and use some off-label use of some of those medications, then I certainly understand the medical community's hesitation, being sure not to create more harm or to create an expectation. But the information that is coming out now is we're 11 months past that. And to not take advantage of that information, I think we would be missing some great opportunities because, and speaking with people in our community, there are so many doctors that are using a lot of steroids, antibiotics, seeing people that end up in the hospital from pneumonia because they got COVID, that's one of the biggest risks. And it's like, well, yes, there are doctors that are preventive of before you catch pneumonia, that they start you on antibiotics or steroids. So the point is to talk to your doctor. Don't just, it infuriates me, breaks my heart that people just go home and sit and wait and they don't know what to do. And then they end up at the hospital and they don't always all survive. And so I am going to continue pushing for the information to get out, because I've had too many conversations. People just have no idea what to do. They wait and then they get very, very serious, and then not all of them survive. And there is so much that we can be using now. And I don't want us to be out of concern because we don't have 10 or 15 years of trials. We do have a year now. And to see the American Journal of Medicine reverse its position, I think they have been more cautious, and to see them reverse it was a good sign to me that there have been adequate studies for them to come on board.
Certainly, we want to get that information out there. I know we all agree it is important to continue working to get that message deeper and deeper into the community. Other questions for Casey or for the city manager? Casey, go forth and conquer. We're giving you big pats on the back, and we know you're passing those out to all the different departments that are working on this issue in our city. Messaging is important. Communicating about it is very important. That's definitely been the takeaway from today's conversation. So y'all continue looking for ways to improve that, I think is important.
Yes, ma'am. Thank you.
Okay. Jared, anything else on that item?
No, ma'am.
Let's move to item 1C, which is a report from council members serving on outside boards. The first board is Beautification and Public Arts Advisory Board. Dr. Sauer.
Okay, so this is really probably the stuff that I'm about to tell you guys is some of the most exciting stuff I think that we've heard in a while. As a matter of fact, we just had our regular meeting, completed it at 12:30 today. So I mean, this information is really, really fresh. So we had 11 applicants for this year's mural grant applications. The 11 applicants submitted $39,275 worth of requests, and we awarded 8 murals with a total of $29,275. It's kind of a catch-22 because that means that for the first time that we actually had more apply than what we had money available for. And I hate it for the 3 that were not accepted, but I love it for the fact that it is really beginning to take off, and it's really beginning to have a really positive effect on the city. So we had, so the way that the grant was set up was the intention of there being to award at least 1 in 5 different areas of town, one of them being downtown, one being in the southeast, southwest, northeast, and northwest. Of the 11 that were submitted, there were only 3 out of the 5 areas did we have grant applications from. We had 1 for downtown, we had 1 out of the southeast, and then the rest of the grant applications came out of the northwest portion of town. So we ended up awarding 6 of them to the northwest portion of town, and then we've awarded 1 for the central business district and 1 for the southeast portion of town. And those will be announced within the next couple of days upon the approval that comes out of the city manager's office. So the one thing that I will say is there were 6 of the grants that were actually ended up awarded to Blank Space. Blank Space had multiple applications, and you know what? They are doing a incredible job of bringing art to life in Amarillo. As a matter of fact, Jason Boyette made a comment that I wanted to quote. He said that this is having, quote, such an impact visually on the city of Amarillo. And that's exactly what's happening. So it's really, really, really exciting. Some of it, a couple of these are going to be on 6th Street. A couple of them are going to be, one of them is out in the Meta Park area. There's several. So we're seeing these being awarded all over town, and it's gonna be beautiful. One of them particularly that is being done at Snack Pack is something that we're all very excited about. I am kind of blowing that one and letting that one out. It's an interactive, and it's the first one that has been awarded that's going to be an interactive type of a mural, and it's going to be a whole lot of fun. So it's really, really exciting. The beautification project, They're still working hard to make the presentation for it. When we meet next month, there'll be a lot more talk about it. But probably really the most exciting thing was we had a Thompson Park Pool update from Michael Kashuba. And so here's what's actually ended up happening. In the outlay of how the Thompson Park Pool in the Lazy River area, in between that Lazy River, there was an original intention that they would have landscape, but it just didn't really seem to work out. And so what they have decided to do is, instead of that, they're wanting to put a piece of public art in that area, and then also a piece of public art at the entrance. And it will be a great way to be able to promote local artists in town. And actually what's ended up happening is, as the beautification and arts is actually kind of part of Parks and Recreation, what we're actually seeing is there's a thought that maybe we will begin to see some ways to put these art installations in a lot of our different parks. And the way to keep that from being a high maintenance type of an issue is going to be that proposing that they may be a rotational, that they'll go through different parks and they can be put up and taken down. But the deal is it's starting with the Thompson Park Pool. And so there's a real opportunity for allowing local artists to be able to showcase their art. And so it's really exciting. You know, this is a thing that I told the committee that this is the fruits of what's happened after what you guys have started 3 years ago, that we would have never have thought that going to the city manager, him finding an area where we would have $30,000 to begin to fund mural art in the city, that it would go from one installation at the airport to now that we're going to have 8 different ones here all across town, to the fact of now then we're figuring out how do we make that part of our Parks and Recreation system, and how does it work into our master plan, and how do all of these things work. So it's just, it was a really exciting day to see that these things are actually coming to pass, and we have this potential for to be able to showcase local artists all over town. It's really great. I can't say enough about it. It's one of the favorite things, and I've said that probably every time I've given a report. It's one of my favorite committees to sit on. They're so creative. It's so exciting. There is such a lot of life that they create, and it's really good for Amarillo. It's really good for what it creates in our community and how things are changing, even in our own community in just the last 3 years. So it's a really exciting thing.
Questions for Dr. Sauer about that report? Just yesterday, or maybe it's the day before, Dr. Sauer, I was visiting with a couple of young college graduates living in our city, and they were talking about the murals and how much they think they've changed the city just by having art, interesting things to look at. And so I was proud that they were noticing, and we have to recruit those guys to come back. We educate them, we pay for them to be educated, but then we need to be working on recruiting them to come back. And so we can get the full investment of what we've educated them with. And it made me happy to hear that that was something they noticed, because for the dollars, it's a really big impact with not that big of a price tag.
Isn't that interesting?
Thank you for the work you're doing there.
I think that's so interesting that really the investment is so small compared to the return that we actually get out of this. It's just really incredible. I would have never thought that we would have this kind of return on the investment that's being made. And that's exactly what I would call it. It's an investment in our community.
Yeah. And I appreciate people like Sean Kennedy at Blank Spaces who are really pouring into it and using the kids of our city to do it. Those kids at Caprock High School that are part of that business model, part of his business plan. It's a great story. Okay. let's move on to a report about the Amarillo Metropolitan Planning Organization Policy Committee. Dr. Sauer, do you want me to take a stab at it, or do you want to start?
You know what? I'm going to let you take a stab at it. The first problem that I always have with MPO is the fact that I think I'm in the military or something. They use so many acronyms in this deal. I had to ask the city manager what TIP was. I wasn't sure what the I meant.
So the Metropolitan Planning Organization is a committee that helps set the policy that spends the federal and state dollars we get for the highway improvements in our community. And really, that's a very high level summary of what that committee does. It is complicated and a very long term. Every project they touch is years and years and years in the making. So it's hard to give a quick summary of the work they're doing. But I did want to bring to y'all's attention, or to at least citizens' attention, that they're coordinating right now a survey where we're asking Amarillo citizens, especially those that are interested in making our city more walker friendly, the walkability in our city, biking in our city, or if you are interested in having more transit options in our city. Please take this survey so that the MPO will get your feedback on how to make those policy decisions moving forward. A few years back, it's been probably 4 years ago, when they were designing the new part of Helium that's going to become the far west side of the loop. And we saw the plans, and we were so disappointed to see that there was a bike lane, but it was attached to the highway. Like there was no space there for safety reasons that would make that bike lane apart, separate and apart from the cars. And when we began talking about, could we make that, draw that differently, we had really already missed our time frame to do that on that section of the loop. And it was, we became educated to the process that our hike and bike plan didn't require that. It wasn't even a stated goal in what the city's hike and bike plan was. So you wonder how all of those decisions get made. They actually get made by policy in things like our hike and bike plan, that then when those projects get designed, are executed based on what we said as a community was important to us in the plans that we published or the policies we published. So how do we make those policies? We're asking for your input, and here's your chance to take the survey and tell us what needs to change in those policies going forward. So please let your friends know about that. This is on the city webpage. It's on the landing page. One of the things that just scrolls across. Thank you, Stephanie. You're doing such a great job of showing people where that is. You just can hit the button to learn more about it and go to the website to give your input on what we should be doing to make Amarillo as a city more friendly to walkers, bikers, people who use public transit. That was my main takeaway, Eddie. Anything you want to add on that?
Yeah, the only thing that I would want to add is, I thought this particular meeting was a little bit different than any of the other ones that I had sat in on. And the reason that I say that is because sometimes we as citizens, or even being on council, kind of feel like, okay, TxDOT, their Department of Transportation, they're doing their things based upon what their mandate is before them, and we might have a little bit of an effect, we might have some effect, but everybody kind of stays in their lanes and does their own thing. And so on this portion of the loop that is being talked about, that's above 9th on around the curve north, we had some citizens come and gave their input on how people are getting on, how people will be getting on to that part of the loop in that area and access, and what that affects how it comes out of maybe a particular development that's occurring over in those areas. And it was really interesting to sit there and listen, because these two particular individuals were talking with us and with TxDOT, And there's a real chance that maybe they're going to shift around maybe how they do a certain part of it based upon the input that actually came from the citizens. And we need to realize that that's what the MPO is there for, the Metropolitan Planning Organization is there for, is to take the input so that when the state and the federal money comes through, we do actually can have a little bit of an effect or have a lot of an effect upon how the planning actually plans out, just like the bike path part of it. Because I can remember whenever we first came on council, and we were talking about the hike and bike, and they were talking about this area over there on Hollywood, and they basically said, I'm sorry, it's too late to do some changing at this point in time. And then you begin to realize, oh, we've got to be 4, 5, 6, maybe even 10 years looking down the road if we want certain things to end up happening. And to have affected that part of it, we probably should have been in the talking process 2 or 3 years prior to when these things were happening whenever it came on council. And so it's just the thing that I thought was really interesting for me was, okay, TxDOT really does want to listen to your input. They really will agree to meet with you. It could change the order that you do things in. I think we live in a great state. I think we live in a great city, and people really do listen, and they try and do the best things that are possible, especially when we're talking of millions of dollars of building highways around our area. And so it was a real interesting conversation to listen to.
Yeah, good point. And those agendas get published on the city website, just like every other city committee. So if that's something as a citizen you're interested in keeping up with, you can just check the meetings tab. We meet basically every other month on I think it's the third Thursday
at 1:30.
1 o'clock-ish. Okay. Any questions about that? Okay, moving on to item 1D is a review of boards and commissions and a sunset policy regarding city boards and commissions. Mr. City Manager.
Hi, Mayor. We had a request from council to put this item on here. The is to have a recurring, scheduled, full sunset review of boards and commissions. Right now, we have, Francis can correct me, but I believe it's exactly 50 boards and commissions, and that includes our 9 PIDs, maybe 10 at this point. So a good percentage of them are PIDs, but we still have more boards and commissions than most cities that I'm aware of. So having a regularly scheduled review, probably citizen-led, citizen-participated review of our boards and commissions through a sunset review process would allow us to assess, is a board and commission still serving a function that deserves its existence, or does it need to be sunsetted or eliminated, to create room for other boards and commissions that council might want to create over time. So I think that Councilmember Hayes, and I don't want to put you on the spot, I think this came from you, and I didn't know if you had any comments you wanted to make there to just start the conversation with council.
I don't know that I had initially, I think it was part of our full conversation probably over a year ago when we were doing some of our appointments on just that conversation of kind of once they get started, how does a committee or board ever end or determine the need to keep going forward. And I think it actually came up possibly in one of our first years of making board appointments because there were so many boards. I think for me personally, that was a shock to even find out that the city had that many boards, and to be sure that we were efficiently making appointments and use of staff time and looking for feedback from staff as well for which of those committees and boards possibly were not necessary in the future, or the way the state legislature determined sunset policy, if we were going to have something like that at the city level.
So council, is that something for staff to work up a policy or a procedure to present to us? Are we interested in having that discussion? That's sort of why we're on the agenda about it today, before they put the work into developing that and bringing it back to us for our input. Just wanted to see what y'all's thoughts were about it. Not everybody at once.
I think it would be worth reviewing and get the staff's opinion on whether a board or commission ought to continue or not. And then bring it to the council and then we can discuss it. 50 seems like an awful lot, but that's the way it is evidently.
And Mayor, one thought of if we just started trying, instead of trying to, eat the whole elephant, of just, breaking it up and taking just, on a quarterly basis or something, reviewing a certain number of the boards and having staff input on that, as preparing for those annual appointments in the fall, to kind of space that out. I don't want it rushed through, wouldn't want to be making hasty decisions, but possibly breaking those up in small segments and reviewing 10 or dozen of them at a time and getting recommendations is a thought.
Okay, thank you.
So what if we ask the city manager to look at other cities? He mentioned a citizen-led committee. I mean, sorry that it sounds like we might consider appointing another committee to help us with this project, but I like Elaine's point of it needs to be an ongoing thing, not so much wait till we prompt it, but just this be a consistent part of the process, and it has to come in small chunks, not in all at one time. So what if we ask the staff to look at how other cities are doing it? What we're looking for is a sustainable, efficient model that would continually review our boards and commissions. Are they meeting what they were tasked with as far as their goal? Are they meeting regularly? Have they met that, and is it an ongoing need? So those are some of the, I think, obvious questions that the five of us have talked about as we've appointed people to positions over the last few years.
Sure.
Jared, would that be something that staff could bring us a proposal?
Yes, absolutely. We've put in place in previous cities, using best practices, researching the state, what is the best practice in cities across the state. It's something that I've worked on before. It's something I know we've got staff on hand that have worked on before as well. Typically, it's not another board and commission. It's a one-time, single-purpose committee that you appoint that does review all the boards and commissions. We'll put together a policy, probably going to recommend every 5 years. Could be every 3, could be every 7. I mean, you're going to have options, but we'll put together a good template if you'd like, and then you can review it and make changes however you want. And if you want to move forward with it, then it'd be something y'all could use, and we can change anything you want in a draft policy. But we'll go ahead and put that together, put it on an upcoming agenda, and have it on for y'all to discuss. We'll give it to you well in advance of that meeting, so you have time to review it, ask questions, so that you're prepared prior to that conversation.
Okay. Any comments to add to that, council?
No, I would like to move forward with that process.
Agree.
Okay, great. Green light to move forward on that then. Item 1E is an update on our recent bond sales. Mr. City Manager.
Well, we've got Laura Storrs, Assistant City Manager and Chief Financial Officer, along with Stephen Adams, Bond Counsel, to walk us through it. Laura?
Thank you, Jared. Good afternoon, Mayor and Council. Wanted to bring you guys some exciting news. It's been a great year for us as far as debt issuances go. We have been able to secure some really favorable interest rates that save our taxpayers a lot of money. And so I have Stephen Adams with Specialized Public Finance here. He's our financial advisor that wants to go over a presentation with you all. We've done 4 recent bond sales, and he's got kind of a recap on how those sales went. So I'll turn it over to Stephen, and I will share my screen with his presentation.
Okay, thank you, Laura. Just to recall that at your January 26th meeting, you authorized the sale of these bonds with the final approval with the city manager and mayor. We sold 4 different bond issues since then, totaling almost $100 million. So it was a lot of debt. And quickly, the project amounts were for the drainage revenue bonds, $10 million. And we sold those at 1.41%, receiving 8 bids with Citigroup as the winner. Water and sewer revenue bonds we sold with project amounts of $28 million and $350,000. And we received 11 bids and sold those at a 1.38%. We sold certificates of obligation for improvements to Greenways PID, and of course they'll be repaying those out of PID assessments, and at a 1.42%. And then finally, we sold the remaining of the 2016 bond referendum, $57.155 million to the project fund of general obligation bonds at a 1.6%. And so all those are really low rates, and we're really happy to get them. And I'll go a little into these just a little bit in detail, Laura. Just a quick graph here. You can see that interest rates are very, very low. They're lower than they've been, almost 96% of the previous, 50 years or more. Next slide. Just to let you know that all 4 of these bonds had AAA ratings by Standard & Poor's, which is the highest you can get. And, there are not many cities that are honored to have this AAA rating. I will say that all 4 are on negative outlook. It's not because of anything the city did. In fact, the management of the city and the way that the finances are managed probably preserve those AAA ratings, given the fact that Standard & Poor's has a negative outlook on all sectors of public finance because of the pandemic that we are currently in. So that's really good, and that's the primary reason you got those low rates. Next slide. This is a slide we wanted to give you an update on. Back when we were talking to the voters or putting out information to the voters in 2016, we projected that the tax rate impact for both Proposition 1 and Proposition 2, and you can see at the top, Proposition 1 was $89,495,000, and Proposition 2 was $20,080,000. The total impact would be 6.77 cents on the interest and sinking fund tax rate of your ad valorem tax rate. We ended up with that being only 5.16 cents, or 1.6 cents lower than we had projected, with aggregate debt service savings lower by over $16 million. Now, obviously, those low interest rates attributed to that, and also your growth in the assessed valuation. And really, it was just, the high ratings also of the city. So much lower total cost than what was shown to the voters. Okay, next slide. This is just the sources and uses for each one. Probably don't need to spend a lot of time on this. So for the drainage utility bonds, go on the next page, just to recap, we got 8 bids with Citigroup winning at 1.41%. And if you go to the next slide, you can see the firms that bid on the drainage revenue bonds, and there were 8 bids. Now, the interesting thing, we did this 30 minutes before the water and sewer revenue bonds. And we know the people over at Citigroup that do the bids, and, we called them after they won this because we had to compare numbers, and they said they were going to bid the exact same thing on the water and sewer revenue bonds. So let's go see how they did. Next slide. Well, first of all, just to point out, this is the debt service on the drainage utility system bonds, and this will be paid out of drainage revenue fees. So it's 20-year roughly level debt. Ended up being a little bit not level because of the low interest rates, but mostly level. Okay, the water and sewer revenue bonds, those were won by Hunting Securities at a 1.38%. Now we got 11 bids on this, a little bit larger issue, which the bond community likes a little bit better. And go to the next slide. And you can see Citigroup got fifth. So everybody saw their bid on the drainage bonds and sharpened their pencil. And 4 firms actually bid ahead of them that they beat. 3 of them they beat on the previous bid. Huntington didn't bid on the other one. So that one of the 11, because we got 3 more bids on the water and sewer. Next slide. This is the debt service on these water and sewer bonds. Again, mostly level, and these are being paid by water and sewer revenues. Next slide. This is the certificates of obligation, the smallest bond issue that we did. We got a 1.42%, a very low rate. Only 5 bids on this one, which is actually a lot on historical terms, but compared to what the city has been getting, not as much. So let's see who the bidders are on this one. The winning bid was Fidelity, and you can see Hilltop, Baird, FHN, and Citigroup. Now, we bid these for Green Hills PID and other PIDs, and they could never get a rate this low if they only had the assessments as their credit. So you're really lending your credit to them, and it's great benefit to them because there's no way they could get a 1.42 with just their assessments being pledged. Finally, this is their debt service on the COs. They're going to be paying about $60,000 a year between now and 2041. And the last bid, the one that everybody really wanted to bid on, we received 12 bids. This is your best credit, voted GO bonds, best credit of most cities, and you received a 1.6%. You may ask yourself, why is it a little higher than the other ones? And it's because it's a little bit longer in duration. So the longer you borrow money, the higher the interest rate. So going to the next slide. And here are the bids that you received. The winning bid was Wells Fargo, and you can see the other 11 firms that bid were literally from all over the country. So a lot of interest in your debt, so that is good. And then finally, you can see the debt service on this goes through 2046, so it's a little bit longer, and it's about $2.8 million, and it's paid for out of the interest and sinking tax rate on the ad valorem tax bills. And that's all we had. I would be glad to answer any questions, but let me just go by saying congratulate you for really very low rates, and enjoyed working with Laura and Debbie and Jared and the rest of the staff with the city on this. There was a lot of work that was put in, and I think it really turned out well for the city. Laura, back to you.
Thanks, Stephen. So just wanted to share those highlights with council because we did it a little differently than we do normally. You all authorized us to enter into these bond sales with certain parameters. And so we wanted just to communicate the results of those 4 sales, and also the good news, as Stephen mentioned, approximately $16 million in debt service savings on the 2016 voter approved bonds from what was originally estimated when we took those propositions to the public. So that's a great win for our community and a great savings in those tax dollars. So any questions that we can answer from council?
I think that's fantastic. Stephen or Laura, could we get a copy of that presentation?
Yes, absolutely. I will get this sent out to council, and I will get this posted out on the city's website. So if the public would like to get a copy as well.
Great, thanks.
Welcome.
So one quick question. So the original thought was the result of Proposition 1 and Proposition 2 was going to be an increase in the interest and sinking on our tax rate of 6.77 cents. And so it ended up, when all was said and done, that it's 5.16. And so we've actually saved the citizens 1.6 cents on their ad valorem taxes by the way all of this has been done and transpired, and us keeping our AAA rating and moving things forward to save money on building and all of those things.
Yes, that is correct.
Thank you for the great work. That's awesome. That's really awesome.
Any other comments? Stephen, thank you. We appreciate working with your firm.
Well, thank you very much, and we appreciate it as well.
The motto of the day is bond ratings matter.
They do.
And just like everything we've kind of already been talking about, whether it's MPO or beautification or making our committees more efficient, we have to have a long-term view on things here at the City Council, because it's been year over year over year of having strong financial department that stuck to financial policies that gets us that AAA rating over and over again. And we benefit from it. It saves our tax dollars, saves our taxpayers money. So I agree.
I'll even go as far as to say, for your water utility, securing water decades ago, where you're not behind on that is really a lifesaver compared to many other cities.
Excellent point. So we just have to keep that takeaway, is keep thinking long term. We appreciate the work you guys do for us on that. Anything else? Questions, comments? Okay. Short-term rental status update, item 1F. Mr. City Manager.
Hey, Mayor. We've got Laura Storrs to walk us through where we're at in the process. We will have letters going out very, very soon, and moving forward with council guidance on that. So Laura, walk us through where we're at right now, where we see ourselves going in the near future.
All right. Thank you, Jared. And I am going to share my screen. I have a very short presentation to share related to this area. It'll play for me. There we go. So this is just a quick update on our progress related to short-term rentals. So as you know, we do have several short-term rentals here in the Amarillo area, or maybe you didn't know because you've never looked for one here locally, but we do have several groups that are utilizing their properties as short-term rentals. And so one thing that we have wanted to do is to get some information out to these groups on some requirements from the state level and the city level. So we work to contract with a third-party group called Lodging Revs. And we asked them to go research all of the short-term rentals that are advertised on various websites. So they did a comprehensive search for us. And on the bottom of this screen is the results that they have provided us. And I understand this is a small map, but you can see there's a lot of dots on that map. And so they were looking at Airbnb, VRBO, and some other common websites where short-term rentals are listed. They provided us with a list of over 100 of these short-term rentals that are in the Amarillo area. So our next steps is we are currently forming some informational letters. What it does, these letters outline both the local and the state requirements to submit hotel occupancy taxes. It is a requirement for short-term rentals, similar to it is what the requirement is for our hoteliers. And so we want to make sure that we provide that information. We're also going to include a copy of our local ordinance related to hotel occupancy taxes, so they can have a copy of that handy with them. Also on this informational letter, we're going to give them the website and the contact information for our third-party collector, which is Avenue Insights. We're going to explain in there that there is a requirement for short-term rentals to register with Avenue Insights and to submit monthly information related to their sales, or if there's no activity during the month. And so we are looking to get these letters mailed out later this week. And again, these are really just an informational letter. We want these short-term rentals just to understand what those what the local ordinance states, and that we're here to help in any way we can. And Avenue Insights has been a great partner with us over the years to collect on these hotel occupancy taxes, and they are there to help as well. And so these will be going out in the very near future, and we'll be working diligently to field any questions that come in as we can. So with that, are there any questions that I can answer for council on this?
Councilmember Hayes.
Yeah, Laura, I had a question on the Avenue Insights and their collection system. So
Yes.
do they charge a percentage? And then comparing that to, I know we had a conversation a couple of years back on the Airbnb, the VRBOs were actually collecting online. They were doing automatic collection. They were entering into agreements with cities. And so just would like to have some feedback on why we did not move forward with those automatic collections on the site, and if there was a fee at that site, as well as compared to then going with Avenue Insights.
Okay, great. Let me see if I can kind of answer those one by one. So first of all, on Avenue Insight side, they charge the city of Amarillo a flat fee for doing the third-party collections. As far as the hoteliers or the short-term rentals are concerned, the only fee that they could pay to Avenue Insights is if they submit those hotel occupancy taxes with a credit card. If they pay with a check or some sort of payment like that, there's no fee for them associated with it. It's only if they do submit those hotel occupancy taxes with a credit card. As far as my understanding is that Airbnb has certain agreements in place to automatically collect some of those hotel occupancy taxes, but it's more at the state level. So there's a state hot tax, there's a local hot tax. The state hot tax is 6%. Our local hot tax is 7% plus a 2% venue district hot tax. Again, my understanding is that those certain groups are only submitting the state portion and not the local portions. If you think about it, the local jurisdictions have different ordinances based on their local community. And I do also know that our ordinance is structured in a little bit different than some of the other cities across the state. And I have heard that there's some agreements in place from a couple of cities, maybe with Airbnb related to their local hot, but we do not have one of those in place. And my understanding as well is it's not maybe as seamless as you might think it would be. It's kind of just an understanding agreement. And I'm looking around. Andrew may have to jump in if I start saying something a little bit wrong, or Brian, because I know they've kind of been looking into some of this as well. And so from our standpoint, we are just looking to, because we know that these short-term rentals, a lot of them probably think all of their taxes are being handled straight through the group that they're associated with. So that's another reason that these letters are going out, to let them know that here in our community, it's a little bit different, and you have to take these additional steps in order to get the local piece submitted. Does that kind of help you answer those?
I still have a question on the, so are you saying that Avenue Insights charges a flat fee per transaction, flat fee for being our collection agency in the city, and the difference between what the city might be getting charged versus what the owner, the VRBO rental owner, might be charged for using a service?
Okay, so on the city side, the city pays per property, whether that's a short-term rental or a hotel. We pay a fee to Avenue Insights for collection per property, and that's an annual fee. So we're not being charged per month, it's per property on an annual basis. And as far as the short-term rentals are concerned, they do not pay any kind of a fee into Avenue Insights. I'm not sure of the arrangements with some of the other groups like Verbo and Airbnb. I'm not sure on the fees on that side, but a short-term rental, to submit the local piece of the hotel occupancy tax, they would just simply sign up through Avenue Insights. They would report their sales for the month, and then they would submit the calculated hotel occupancy taxes, the local piece related to that, and not pay any additional fee unless they were paying with a credit card.
And I guess the fee for a short-term rental is less than when you're saying a per property. It's got to be less to collect from a property owner than a hotel. I would think it's not the same because the revenue source is totally different.
And I'll be honest, I'll have to look into that. I don't have that information handy. I can look into that and share that with council on if there's a difference in that fee between the hotels and the short-term rentals. But again, it's a very similar process that the hoteliers encounter versus the short-term rentals, and from the collection side. And you're correct that the revenue looks very different, but it's still a monthly information. It's monthly information that's submitted, and then there's a calculation of what that tax is, and then that tax is submitted. So I will follow up with council on the breakdown between the flat fee that we're paying for short-term rentals versus an actual hotel.
Thank you.
Other questions, council?
Got a question. You said these short-term rentals are supposed to register. That's with the city?
They need to register with Avenue Insights. So that's basically telling them that they are an active short-term rental, and then it gets them qualified to start submitting monthly information related to their sales or that lack thereof, because sometimes short-term rentals go for a period of time without any kind of activity. But it lets Avenue Insights know who these short-term rentals are and to be looking for future information from them related to sales. So they get registered, and then they can just submit that information online on a monthly basis going forward.
Thank you. The number of 100 or approximately 100, is that many? How many have registered? Or
no, not at this time. I don't think our numbers are quite that high. And so that's why we're really wanting to get these informational letters out, to get the word out there that as a short-term rental, there is a local hotel occupancy tax requirement. And here's the steps you take to get registered and to start submitting that on a monthly basis.
Approximately how many have registered?
I think we have.
Laura, it was 21.
Okay. Yes. So we have a ways to go to make up that difference between over 100 and the 20 or so that are actively registered.
So the 100, that's approximately how many short-term rentals are operating in the area, because they screen the internet on who's advertising.
And that is correct. And here's the, the interesting characteristic with a short-term rental is just because they are advertised on a website doesn't mean that they are actively renting out space. And so, we could say there's over 100 that have been identified that are active to be rented. That doesn't mean that there's 100 each month that have any kind of activity. And so, you know, it will be, it's going to be a learning process, I think, for us and for these short-term rentals as we kind of navigate through what this looks like going forward. Again, a short-term rental could potentially only be renting out space even once a year. I mean, it could be as infrequent as that, but at least these are the ones that the Lodging Revs group identified as having an advertisement out on a short-term rental website.
Thank you.
And I guess, Laura, some of those could be by monthly rentals only, which would exempt them if it's a 30 days or longer rental, would exempt them from HOT. Is that right?
I'd have to look into that. I think that is correct, but we'd have to do a little more research in order to determine if that's why some of them may not be registered. But yeah, that's certainly a thought on that.
Have you guys been able to run any calculation on what you think the HOT revenue we're missing because we are not collecting from these 100 or so, maybe more STRs?
You know, that's a really good question. And I've gotten that one, even from our hotel standpoint. I've gotten that question on delinquent hotel occupancy taxes for hotels that have missed a month or two of filing. I've had the question, well, how much do they owe in hotel occupancy taxes? And the interesting thing about it is it's self-reporting. And so, you know, those entities have to self-report, and then it calculates that hotel occupancy tax. So from a short-term rental point of view, and again, we're a fairly unique community here in Amarillo. We can't really compare ourselves to somewhere like Austin or Dallas or South Padre that also have a lot of short-term rentals because the activity probably looks a lot different. So I don't know that we have a good way at this point to estimate what we potentially could be missing out from a short-term rental standpoint. Because if these short-term rentals are renting out multiple times a month, or they could be renting once a year, they could be listed and not even renting in the year. It's very hard to tell on that. A very good question, but it's an interesting one because it's a self-reported sales.
I think, and nobody likes anecdotal information. And if we're under the assumption that we're dealing with rough operations, in total, that's roughly the size of a normal hotel, maybe slightly bigger than your average hotel, your average 3-story hotel. But and nobody wants anecdotal information, but I think we all agree that they don't have the same occupancy rates that a hotel has. So we're not talking about a huge amount of money. What we are talking about is an equitable operating posture relative to our other hospitality organizations, which are hotels in town. It's not a desire for anything unfair. It's just a desire for a level playing field for STRs and hotels. I don't think anybody is going to assert that STRs are operating at near the occupancy rates of hotels, 80% and above, which is what we've seen recently. In many cases, higher than that. So I wasn't really going anywhere with that other than to say, we do know roughly how many we think we have, and we do not think they're running the same occupancy rates as most of our hotels here in town. That said, we're wanting to communicate very clearly with them that they do have a very clear obligation to be remitting their hotel occupancy taxes accurately.
And we need to be sure we're providing them that information of what that road looks like. And that's exactly what you're describing, Laura, because I have heard frustration from some of the STR managers that it's like, we get it. We're supposed to be paying. Sometimes the process of how we're supposed to be making those payments. And so I think this clarification is going to help. And I think just the self-compliance for the majority of those we're going to see within our community.
And we're going to make it as clear as we possibly can in the written documentation we send them, but we're also going to give them phone numbers where they can reach out and we can walk them through the process verbally and even in person if necessary. We want to make sure that we're doing everything we can to facilitate them getting registered and remitting those payments, because I don't think anybody's wanting to misrepresent things to the city. In large part, they just weren't aware.
Right. And my questions on the charges on the fees is just to be sure that we're not going to be paying a third-party collection agency more than the revenues from those properties. Because exactly, if it's not a percentage and it's a flat rate and they're not renting that frequently, then I don't want to give away all of our revenues, even whatever, if they're a small amount.
And that's certainly a fair
every dollar.
Yes, and that's a fair statement, and it is a concern. But at the same time, you know, we want everyone to be on equal playing grounds, and need everyone to get registered that potentially could be renting out properties. And so it is a little bit challenging, as you mentioned, with a flat fee in a case like this, because if there's not much activity, it could potentially on a single property not net to the good for the city. But again, we're going to learn a lot as we walk forward with all of these STRs over the next couple of months. And again, as the pandemic starts hopefully calming down, then hopefully these STRs will have more and more activity picking up, and hopefully that will be a moot point. But I still will get that information on those fees for council.
Laura, I think the city manager and Councilmember Hayes brought up good points also about how are we communicating this to our local hotel industry owners. Again, just what we want is equality. Everyone who's offering rooms for sale every night in our city to be under the same tax structure and all of that. So just making sure that hoteliers know that this is what the city is doing to better communicate with STRs. And I think that's an important communication point.
Okay.
Councilmember Hayes, you may have a comment on that, serving with on the CVB with local hoteliers.
I think that what you stated is correct, is that looking for the equity in that. And but it's been interesting. We've had some STR owners on some of the past boards, and so their feedback was helpful as well, of saying we're willing to be good partners and want to be good partners. We just need to know what we're supposed to be doing and how to do it. So I think what you're doing is very needed, Laura.
Great. And I think, Mayor, you bring up a great point, and I will reach out to Cashin and see if we've got either a distribution list for the Hotel Association. Might be a great place to kind of start. So we can get some information out to that group on what's going on with these informational letters as well. I know I've met with that group before, but it's been several years ago, and I don't know if they're meeting regularly right now, but I can work with Cashin to maybe help get that message out to them on what steps the city's taking just to get this information out to kind of create equity across all those that are renting out spaces.
Thank you. Any other final thoughts on that? Okay, let's move on and do the quarterly budget update, item 1G.
Well, normally and historically, we've handed off to Laura Storrs at this point. Today, we're going to hand off to our Director of Finance, Debbie Reed. Debbie?
Uh-oh, Debbie, microphone.
Is Debbie muted?
See her, Jared.
There she
There
is.
we go. How's that?
Okay.
Good. I turned my video on and forgot to turn my sound on. So good afternoon.
To all of us. Yeah, thanks, Debbie.
Today we'll be reviewing the quarterly budget update for the first quarter, which is of course October through December. So Stephanie's helping me with the slide presentation there. We're going to start off with general fund budget. So the first item that we'll look at for the general fund are the general fund revenues for the 3 months ended December 31st. And you can see that budgeted revenues for the first 3 months would have been around 59.7 million, and we've actually come in at 60.5 million. So we're ahead of budget by 834,000 on the revenue side. That's 1.4% above budget. In the next slide, we'll go over what those major revenue variances are. On the property tax revenue side, our taxes are 1.2 million over budget through December. A lot of times with property tax, it's a matter of timing when the property tax payments come in, especially between the month of December and January, and especially when we get those large payments from the mortgage companies that have many tax payments coming into the city. On the sales tax side, this is good news. We are up $1 million over the budget through December, and I'll talk a little bit more about that on a future slide. The next item there you'll see is hotel occupancy tax, another one that has really good news for the city of Amarillo. We're ahead $436,000 through the first quarter, and again, I'll have more details on that item on a future slide. Our gross receipts tax is slightly over budget by $25,000. Those kind of track about the same from year to year unless we make a change in our fees. Licenses and permits is over budget by $176,000. And the main area here that's bringing in more money is our building permits. So that tells us that our construction activity and development in the city of Amarillo is remaining strong, which is great news for the city of Amarillo. Our charges for services are slightly under budget by $646,000. This is more due to some of our recreational type fees, maybe the golf, recreation fees, the civic center, some activity that is more seasonal. Some of it would be the effect maybe of COVID as well, still lingering on through this first quarter. So we hopefully will see that level out throughout the remainder of the fiscal year. Our fines are under budget slightly by $287,000. This is in the traffic fines and parking fines area. Again, probably along the lines of less activity due to the COVID restrictions still lingering on in this first quarter. So the next slide we'll look at is the general fund expenses. Here through the first quarter, the budget is $48.8 million. The actual expenditures are $50.2 million. And you might think, why are we over budget through the first quarter? The big item there was the purchase of the Amarillo hardware building. If you'll recall, council approved that purchase and it was made through excess general fund reserves as of the good results of last year's fiscal year end. If we take out that purchase just to compare operationally how the general fund is doing, we had a variance of $1.4 million over budget through the first 3 months, but without the purchase in there, that difference would be $3.3 million. Positive, we would be underspent according to budget through the first 3 months. Most of the areas in the general fund are running under budget. I think this is due to city management direction that we hold the line on spending. As we continue through this journey of COVID, we want to make sure that we kind of hold the line and make sure that our revenues track well and keep us strong financially. All areas like professional services, supplies, utilities, and contractual services are all trending under budget in most departments. The net variance then, one more item on that last slide, Stephanie. The net variance overall then, this is the difference in revenues and expenditures. With the Amarillo purchase in there, the Amarillo hardware purchase would be $550,000 more expensive than revenue. But when you take that out, we're actually $4.1 million positive, more between the less spending and the more revenue. We're in good shape through the first quarter of fiscal year 2021. So now let's dive into some of the details of some of those revenue line items. So the first one is that we'll look at is sales tax. And again, this is trending very well through December. You'll see on this slide, we're comparing fiscal year 1920 to fiscal year 2021 actual. And through the first 3 months, we're $1 million more in sales tax, or 6.9% above. So that's great news for the city of Amarillo. We did budget conservatively on sales tax. This was not knowing how COVID would continue into the new year. But as you can see, the retail spending in Amarillo has remained very strong. And that's great news for the city. The next revenue item that we'll look at is hotel occupancy tax. These are trending well. As you can see, again, the same layout here on this slide. We're comparing last year's actual to this year. We are 2.11% more than last year on gross collections. Keep in mind, the one thing interesting about this being the first quarter, we're comparing it to last year first quarter, which was pre-COVID. So not only are we seeing good results coming out of COVID, but exceptionally good results when you consider that last year first quarter was a pre-COVID quarter, and we're comparing it to a coming out of quarter. So we're 36.14% above budget year to date. Now, keep in mind also, we did budget lower this year because we wanted to be conservative on our revenues, not knowing the continued effect of COVID. One thing that we feel is helping in this area, we have a lot of medical professionals staying in the city of Amarillo to help us with COVID response. And we certainly appreciate that medical staff being here and that we have excellent hotels to accommodate their needs. And also, I think many people are traveling by car instead of flying. And Amarillo is a pass-through. When they go to the mountains in Colorado or New Mexico, they're passing through our city and they're stopping in our hotels and also frequenting our restaurants and hopefully shopping too. So hotel occupancy tax is doing very well so far through the first quarter. The next revenue item is the gross receipts business tax. This is just slightly ahead of budget at just $25,000. So we're pretty much tracking. Oops, Stephanie will have to change one slide there. There we go. This one is the franchise fees for electricity, gas, water, sewer. These are all those other businesses that have lines running through the city and we charge them a franchise fee. So these revenues are trending pretty much on target with budget. Okay, and then the next area we'll cover are utility sales. These are the sales activity through December again. And here you can see that we're going to look first at the general fund. In the general fund, we'll look at the solid waste fees. And we here are just about equal to the budget for the year. So we're comparing the annual budget, the budget through December compared to actual, and we're pretty much right on target with sanitation fees. In the water sewer fund, you'll see we're looking at water sales and sewer sales. Water sales are ahead of budget by 7% through the first quarter, and sewer sales by 2%. So overall, a 5% ahead of budget in the water sewer fund. One thing to think about here is that, you know, the fall has continued to be a very dry month. And the state actually reported that the calendar year 2020 was the 8th driest year on record. So, you know, last year we had very good consumption in our water sewer fund, and that's continuing through this first quarter. Now, one thing we'll do is we'll monitor this throughout the fiscal year. When the summer months come, or even the fall or the spring, if we have a very wet spring or a very wet summer or more than usual wet summer, that could affect our revenues before we get to the end of the fiscal year. So we always continue to monitor that. The drainage fund is pretty much right on target with budget. So those are our utility sales revenues there. The last item that we'll cover is our health insurance fund. We always like to keep an eye on the medical claims for the year. You know, last year the medical claims and the health fund ended well, and we really believe that had a lot to do with the COVID restrictions. You know, they had elective surgeries were shut down for a while. A lot of people were not actually going to the doctor with the COVID restrictions in place, so we had less cost to the plan as a result of last year. Now this year in the first quarter, you see that for the medical claims are 7% ahead of budget on the claims expense, about $396,000 beyond the budget amount through the first quarter. Now this could be the effect of the COVID restrictions being lifted, and so maybe more people have been going to the doctor or having elective surgeries. Another thing to keep in mind, the first quarter of our fiscal year is the last quarter of the calendar year. So many times medical claims expenses to the plan are higher in that last quarter of the calendar year, first quarter of our fiscal year. So we'll monitor these claims as we go through the fiscal year. We should see them kind of be a little bit less in the first calendar quarter as participants would not have met their deductibles. But again, we'll monitor this closely as we always have. So with that, Council, that's our first quarter results. The fiscal year is off to a very strong start, and so I would answer any other questions that you might have.
Do we have any questions for Debbie, Council?
I just had a comment, that observation of just the, estimating all those different areas outside of hotel and sales tax. Those are things that are very much market driven and outside, but all of the internal operations, it amazes me how closely those were projected and how right on track we are. So good job.
That would be the team before me. first budget coming up. So, but Laura and the team, they have done a good job. You have a lot of experienced finance staff here, and that's really helpful to the city of Amarillo. They know the operation, they know it well, and we have a very good team, and I'm just thankful to be a part of it.
It's a great comment, Elaine. I appreciate you patting them on the back. It's true. Anybody else? Questions for Debbie? Debbie, we just need more revenue. So that's your job, more revenue.
Yeah, I think I'm just kind of excited about the fact that we're actually showing some signs of returning to what we were pre-COVID. And I think that's an incredible thing that's actually happening here in our community. And that's a really, really great sign.
Debbie, I had one question on the hot collections. And are we seeing, I know during the worst part of the pandemic, we did have a lot of our hotels that were really struggling with making those payments, had gotten behind. Kind of where are we on that? What percentage of our hotels are participating now in those collections? And do we still have things that are in arrears?
We actually have, I think, a very, very solid collection on the hotel occupancy tax. If you think about it, the hotels, even though they would have been struggling as far as level of occupancy, the hotel occupancy tax is really above and beyond what they need for their operations, for their revenue source. It's really not their money. So they would only be remitting what they collected above and beyond their sales, to then remit to the city. The reports we're getting now from Avenue Insights, we have very low amount of hotels that are behind on reporting.
That's good. That's good for us and good for them. So yeah. Glad to hear that.
Anybody else questions for Debbie? Okay, Debbie, thank you. We appreciate the work that you're doing, keeping an eye on the numbers. Let's move on and do the sales tax update.
Thank you.
Andrew?
And let me just get my screen set up here. So as a reminder, the more detailed report for these sales tax and financial indicators were included in your weekly report last week. So this is just a one pager to go over some of the highlights that we've seen. A little different than what Debbie just presented. This is fiscal year to date through January, which is August through November actual sales. So just keep that in mind. So the overall performance, we're seeing that it's up 5.78% compared to last year. We've seen 6 months of increases on the sales tax front, really led the way by November, where we saw a 12.8% increase compared to last year. So we're seeing really strong performance on sales tax. Retail continues to be the theme of what's really lifting the sales tax collections for the city. As you can see there, it's 12.77%. And the retail category, one, it has the majority of our taxpayers, just under 5,000, which is 27% of our taxpayers. They've seen 7 months of increases on the collections. General services is up 0.15%. It's been mostly down. It's had one month that was up and then 8 months of decreases. So it's good to see fiscal year to date that it is above 0%. So it is improving. Food at 0.71%. Just recently, they've been down 1 month, but up for 3. So seeing pretty solid performance there. Professional services is seeing a decline of 24%, and they actually make up about 17.5% of our taxpayers, and they've been down 11 months in a row going back to late March. So that's an area that has been impacted on the sales tax collection front, most likely due to COVID. Wholesale up 5.63%. And that one's had three consecutive months of increases. Miscellaneous up 56%. That one's had 7 months in a row of increases. Manufacturing is down just slightly under 1%. And they've also, they've really alternated each month. They'd have 1 month up, 1 month down, fairly consistent in that regard. And then agriculture and accommodations continues to be in the 50 to 64% range, but it's a little bit of an anomaly in the numbers because we really don't have a lot of taxpayers. Agricultural, we only have 89, which is 0.5% of the overall, and accommodation only has 24 or 0.1% of our overall taxpayers. So ag's been down. Actually, I went back and looked. They've been down for 20 months in a row, and accommodation's been down for 11 months right after COVID really started impacting things. Just to give you a little more historical context on how some of these are performing. A little more detail on retail. Non-store retailers continues to be the highest increase at 77%, which is actually down a little bit. April through November, we had anywhere from 104% to 173% increases compared to the previous year, but still seeing very strong numbers there. Building materials as well at 26%, miscellaneous stores 12%, furniture 6%. Sporting goods and hobby and bookstores are still performing very well compared to the last couple of years. They're up 9%. Really the biggest negative I wanted to point out was clothing and accessory stores, still in the negative 2.43%, but this is actually performing a couple of points better than we typically see. So I think it's a good sign that it's moving closer to the breaking even point. And as far as the food category, restaurants overall up 1.38%, but did want to point out full service restaurants is continuing to be in that negative category. They have been going back toward when COVID started, and then the last couple of months, it's actually continued to, that number's grown a little bit more, a couple of points each month compared to limited service eating places are at 9.09%, still performing very strongly, mainly due to the drive-through and quick service atmosphere of the limited service eating places. On remote sellers, briefly, this is, of course, a category that started up with the changes in the sales tax collections and the state law changes. Started back in December 2019 at the 20,000 collection amount. So now we're to a point we can actually compare to the previous year. December 2020 was actually up 152%, and January 2021 was up 100%. So we're starting to see pretty solid collections on that front. And I looked at the state's database, and there's almost 4,500 remote sellers now registered. So any of those that do business shipping to Amarillo, the city will benefit from those sales tax collections. And then just to touch on hotel occupancy performance, December 67.2%, November 67.5%, and October 64.1% are actually the highest occupancy rates that we've seen over the last year. And those months are the highest that we've seen since fiscal year 17 and 18 when you look back a few years. So it is performing a lot stronger than it was previously. And then average daily rate, you can see there it's been over the last few months, $71 up to $76, which is pretty comparable to what we were saying in the previous year, which was pre-COVID. So we are starting to see ADR getting back up to where it usually is. And then lastly, the Amarillo workforce snapshot, the unemployment rate for December was 4.9% compared to 2.3% in 2019, which matched the Amarillo MSA of the same rate, 4.9%. That compared to Texas at 7.1%. And the U.S. is 6.5. We still are seeing many of the industries are still showing decreases in the jobs. A few of the highlights for the monthly change: government at 0.5% up, leisure and hospitality was seeing an increase at 1.1%. And the one negative on the monthly was education and health was down just under 1% in the job counts. And then yearly change, manufacturing, information, financial activities, education and health, and leisure and hospitality were all still down for the year, with leisure and hospitality being the largest. But it is a little bit better than it was in previous reporting cycles. They've dropped a few points there in their percentages. So I'd be happy to answer any questions you might have.
Andrew, I had a question on the bars, the negative 28%. Where are we right now on our capacity restrictions? I know all the drinking establishments were, are on different schedules. Are they the same with everyone else right now? And this is the numbers you're giving us are August through November.
Right.
So hopefully these averages are weighted maybe that were worse earlier in that time period, and maybe we're seeing it come up. I don't know if you want to speak to any of that, address any of what we're seeing more in a snapshot right now, as opposed to the whole 4 or 5 months.
Sure.
But specifically on the bars, any other information on that?
Sure, I could actually drill into that a little bit deeper for you to give you the last 4 months specifically, so we can see if we're seeing a better trend for those. But yes, those were some of the time periods that they weren't allowed to open. That's only been about in the last month or so that they were open. I believe it was just Randall County that allowed them to open originally. Minnie and Potter County did start adding food services, so they were able to permit that way, and they were able to open as well. So I don't have the specific numbers of which ones were still closed, but we could get that information for you to help put this in a little bit more context.
Councilmember Hayes, all of the bars while we were in area of high hospitalization, like Andrew said, were closed. Now that we've been not an area of high hospitalization for the last week or so, they've been out. All of the bars that were in counties where the judge had filed the requisite paperwork with TABC can open at 50%. Both counties have done that. Both Potter County and Randall County have done that since we've come out of that classification of area of high hospitalization. So they can open now, but they were closed for the last handful of months. And even prior to that, allowed to open right before we became an area of high hospitalization.
So they're at 50%, restaurants are at 75% now?
Yes, ma'am.
Any other sales tax questions for Andrew? Andrew, thank you. We appreciate that. Okay, item 1I is to request future agenda items and reports. Anything that council has they want to ask the city manager about? Nope. Okay. Do we need to take a break, or do y'all want to press on and do our consent and non-consent agenda? Thumbs up to keep going. Okay. All right. We'll keep going. Anything on the consent agenda that needs to come off for further discussion or questions? If not, then let's entertain a motion on the consent agenda items.
Mayor, I move to approve the consent agenda as presented.
Second.
It's been moved by Councilmember Powell and seconded by Councilmember Sauer to approve the items on the consent agenda. All those in favor, please raise your hand. I see 5. Thank you. So that passes with the 5-0 vote. Moving on to item 3A on the non-consent items, consideration of ordinance number 7910. Mr. City Manager.
Hey, Mayor. I'm going to call on Laura Storrs to present the item. This is a budget amendment to reflect some of our operational necessities over the course of this year, primarily with PIDS, but financially more with public health than anything else. Laura?
Thanks, Jared. So council, as you'll probably remember, about this time every year, we bring forward any necessary budget amendments to be made to the prior fiscal year's budget. And I know we are sitting at the 1st of February, and we're talking about amending a budget that ended September 30th of 2020. But this is just some of the final work that we do to be prepared to present our audited financial statements to council, and those will be coming to you all for consideration at your next council meeting. I'm going to go ahead and share my screen real quick. This is a very short presentation, and then I'll open it up for some questions from council. So again, these are the fiscal year 1920 budget amendments. And here's a list of those necessary budget amendments that we would like council to consider. As you can see, and as Jared mentioned, the Public Health Fund obviously encountered one of the most unique years probably that they have ever experienced. We had a significant amount of additional expenditures in the public health area. That was mainly related to all of the testing, our drive-through testing facility, our contact tracing, those activities. Now, we did receive some additional grant dollars through the CARES Act to help aid in the public health operations. We did receive some actual assistance from the state, but there were additional expenditures that they encountered in order to do their operations in such an efficient way throughout the pandemic that was in last year. So we are looking to amend the Public Health Fund budget by $1.2 million. And just so you are aware, the funding for that, as council is aware, last year, the general fund operations had excess reserves related to the very efficient spending that all the departments went throughout the pandemic. Not sure how revenues were going to come in. There were several measures put in place to really pull back on spending. We were also very fortunate to receive a significant portion of CARES Act funding through the coronavirus relief funding that went into the general fund operations last fiscal year. And with those combined efforts, we did have excess reserves. And those excess reserves are staying to help continue funding COVID-19 responses. And so last year, you can see that there was about $1.2 million that went to help aid in the public health efforts. The next item down is the compensated absences fund. There's a $500,000 budget amendment that is needed for that fund. This is the fund that all of the sick and annual leave and comp time balances are paid out of upon termination, whether that is someone leaving or retiring from the city. We have certain policies on the amount of leave that's paid out. It comes out of this fund. This can certainly fluctuate from one year to the next, and we are basically funding it on a pay-as-you-go basis. So we're needing about $500,000 in a budget amendment in that compensated absences fund. There's a small $12,000 budget amendment needed in court security fund. That is where your bailiffs are paid for over at municipal court. As you can imagine, we really ramped up their efforts this prior year. They were our front line as people were entering into the courts. They've done a lot of screening in that area. So we need a small amount to amend that budget. And then these last four here are related to your public improvement districts. As you all are aware, these are all funded by assessments in those areas. We work with those PIDs each year to develop a budget based on what we anticipate expenditures being. But as you can see, sometimes expenditures come in a little higher than anticipated. And so this is just putting forth budget amendments to adjust that budget to the amounts that were actually spent. But again, these are all self-funded, and we have provided this information to those public improvement district boards. Are there any questions that I can answer from council on this? And again, this is an ordinance, so we'll have first reading today and second reading on February 23rd.
Yes, Laura, I had a question on, so when we're amending the budget, you're listing, these are all amended expenses. They are categories where our expenses are being increased, but we have some offsetting revenues. And
yes.
So all we're being presented is the the amendment on the expenses. Can we also see, I'd like to see the net. It's like we're having some net changes, but we had some revenues come in. And because all of these are not being taken out of those reserves that we were able to hang on to last year.
Yes, that is correct. And to answer that question, the only one that we used any kind of reserves to pay for would be in that public health budget amendment. And you are correct. We are amending the expenditure side of the budget. And as I mentioned, public health did get, I think they had a few $100,000 that they received in additional grant funds. But then they had additional expenditures that we covered that did get paid out of excess reserves that we had in place. The rest of those funds, they either had on the PIDs, again, they were very small amounts. And so they may have come a little bit out of reserves, or they may, because their assessments normally come in almost exactly on with what we budget in those areas. And then the court security fund, it actually did slightly go into reserves, because that court security fee is related to those municipal court fees that we have gone over several times with council. COVID has had an impact on that. You know, there haven't been as many citations out there, not as much activity on the streets when we were at shelter in place orders. And so those revenues did trend below. But in all these cases that we're bringing forward, the funds are very healthy. Everything's in good shape. It's just a formality to get those budgets amended on these legally adopted budgets.
So it's really just that public health fund. And so do we not amend the side of the budget for revenues?
No, we do not. And in this case, so on the public health fund, we would be amending a revenue budget for a transfer in from general fund on that. So it's more or less an equal and offsetting amount to that fund as a whole. On the general fund side, we're not looking to do any kind of a budget amendment for a transfer that was going to public health, because again, your general fund departments did an amazing job of pulling back on spending. There was a hiring freeze in place, and those savings from the expense side more than covered this amount that needed to go over to fund COVID response over in public health.
So next year's budget, would it have a category on revenues of CARES dollars? Because it was a source that came in that we are transferring from. Or at least, again, if that, I guess I'm not understanding how, because money is magically appearing in our budget if we don't amend the revenue side as well to show that was not a revenue source we expected. And so, you know, I don't know how that ends up balancing, other than if it's just coded, it's just revenue, but wasn't shown what we received from either state or federal funding.
And that's a great point. As we get additional grant dollars in, we increase the revenue budgets and increase the expense budgets. So there were some, as I mentioned, there was a few $100,000 that public health received, and those revenue budgets went up, and those expense budgets went up equal and offsetting. And on this $1.2 million that's going over there, yes, we would show that revenue on the budget side coming in from the public health standpoint as well, offsetting those expenditures being spent.
Okay. And you mentioned on the compensated absences that we kind of do that pay as you go. Did we have more people retire that we were not projecting this year? Do we not keep, I know you guys are amazing at always keeping so many extra reserves. And so is this just kind of trying to bolster up our reserves, or are we really short these dollars if we don't transfer them?
Well, and if council will remember, we talked about some transfers going into the compensated absences fund when we met on budget review back in the summer. And yes, you're correct. It is on a pay-as-you-go basis at this point. We're working to build in a dedicated funding source for that going forward. We normally budget this fund on about a 3-year average. But, you know, if you have even a couple of more tenured people that retire, that can certainly make one year look very different than another year. And so, again, we try to have a good conservative budget each year for this fund. But as you can see, we did budget slightly low in that year. And we did have some tenured retirements that occurred in this past fiscal year.
And I think it's important to remember, we are in a transitional phase with regard to compensated absences. We had a reserve fund that we used for the last decade to pay compensated absences. that fund was fully depleted in the last fiscal year, the previous, not this one that we're making an amendment to, but the previous fiscal year. So we are working to make sure that we have cash funds to be able to that we have funds to be able to cash fund that. But what Laura was saying about some of your tenured employees, especially if you have a tenured employee in public safety, they're going to have a larger payout than any other employee. And that's what we experienced this year.
And then on that court security fund, will we be able to get reimbursed from CARES dollars on that? I mean, it's not an exact like some of those others. It is because of COVID and the restrictions that those revenues were not there to cover the cost of the salaries and the maintenance of that court. But is that one we get to list on those dollars when we are requesting reimbursement from the state?
We don't currently have any active grant funds or CARES Act money that it would qualify for, but that is something that we are keeping in mind as more funding starts coming forward. That would be something that could potentially be eligible. We don't have anything at this point that it would be eligible for. Great questions. Anything else?
Okay, thank you, Laura. Do we have a motion with regard to ordinance number 7910?
Yes, Mayor. I move to adopt ordinance number 7910 to amend the City of Amarillo 2019-2020 budget by $1,728,500.
Second.
It's been moved by Councilmember Powell and seconded by Councilmember Hayes to approve ordinance number 7910. Any further discussion or questions about the motion? Okay, all of those in favor, please raise your hand. All of those opposed? I saw 4 hands. Councilmember Powell, did you intend to vote for or against?
4.
Okay, thank you. Maybe I dismissed your hand. That passes with a 5-0 vote. Item 3B is consideration of ordinance number 7911. Mr. City Manager.
All right, Mayor, this is creating a civil nuisance to allow us to enforce illegal dumping utilizing a civil penalty rather than a criminal penalty. We went over this in work session, got our new Director of Public Works, Donnie Hooper, to give us a abbreviated presentation that you have previously received. We'll absolutely go into as in-depth responsive questions as you would like. So Donnie, take it away.
Thank you, Jared. This is just a brief recap of what we went over last week of ordinances. This is, of course, getting to the first reading of that, and I'm having a little bit of trouble with my screen. There we go. Can y'all see that okay? Okay.
Yes.
Some of the challenges that, of course, we talked about last time that we spoke to you was being unable to identify the people responsible for illegal dumping in our community and making it difficult in turn to prosecute those, and also having to catch someone in the act of doing that or having a witness that would be willing to come forward when that's occurring just makes it really hard to prove some of these cases, and also not enough personnel to monitor those hotspot areas that we have makes it really challenging. And the current system that we're using now to review the video footage takes a long time to go through when we have an event that takes place, say, over a weekend when those events occur, just to be able to find those areas. So the solutions that we have for that, as we brought to you before, was getting some portable cameras that would be able to be monitored by a professional security company so they could nail that down to a specific time frame when an event occurred. This equipment, of course, is all state-of-the-art. It's motion sensitive, weather resistant, has night vision. And these cameras, of course, can make out license plates from quite a distance away, up to about 200 feet. A detailed reporting system that comes along with that as well, and being able to identify perpetrators to take legal action. And on this first reading of the ordinance today, just to remind you, this is an ordinance that really gives us, it's another tool that we'll have in our toolbox. We have tools currently in place now, but this just gives us another tool ability to impose civil penalties, as Mr. Miller mentioned, much like we have in environmental health and code enforcement. Also, the ability to use photographic and video surveillance to issue those notices of violation, and the ability to hold the owner of the motor vehicle liable for illegal dumping. So that's really the high-level look at what this ordinance is about. I know that Brian McWilliams is on the Zoom today as well, and if you have any questions, he's probably going to be able to detail, or any of us that serve on that task force could do that as well. So just open it up for your questions. Be glad to try to answer them.
Any questions, council?
So did I miss the timing on implementation? Or I guess we have to approve it.
Yeah, once this is approved, if approved, we're probably looking at about a 2-week time period once we can get something into place, or contract to get something put in place to start that process and then begin that. So, I think we'll probably see some results right away from. So it's not something that's going to take a long time for us to implement and start seeing results.
But it'll go into effect immediately. We just won't be ready to utilize it for a couple of weeks.
Yeah.
I have to say that is not the typical government response, Donnie. I am so excited to hear. It's like, no, this won't take us long. We can move into this quickly. We can actually implement this fast. We have all learned how slowly these things progress. So I love that response. Thank you.
And I think it goes back to the homework. We put a lot of homework into this. We've been working on it for, the past couple of months, and a great team of people that have come together to come up with solutions, and the research that we've done, even with members that are not on the task force, to be able to find these solutions and work with these companies. So, it has taken us a while to get here, but we're ready to go. We're ready to see this problem go away.
Good. It's good to have a plan for it, and it's good to have more than one tool in your toolbox. This is something that I am seeing more and more email about recently. And I think it's just when COVID hit and we put in the hiring freeze, and then you guys started getting behind in actually having employees in the hands to go out and do alley cleanups, then it's funny how long it takes before it bothers people or before they actually start emailing elected officials about it. So I know y'all are getting on top of that now that you're back to hiring, and you're shortening that list of alleys where people had called to say my alley needs attention. But anything we can do, Donnie, to help this task force come up with other ideas to stop the problem from happening to begin with is something I think I would certainly be in support of. So I think this is a good idea, and we'll keep working on that problem.
Mayor, I needed to correct, just to be super clear, because of the nature of this ordinance dealing with the civil penalty, we will print it twice in the newspaper, and it will go into effect 10 days after the last printing. This is just some of the minutia that takes effect, but that timing is going to match the timing that we have to have in order to get the equipment in place to document the citations. So there will be no holdup on that, but council approving it here will set that whole process in motion.
Good to be very clear on that. Okay, any other questions for Donnie? We have a motion on ordinance number 7911.
Mayor, we do. I move to adopt ordinance number 7911 to amend chapter 8-3 to provide for civil nuisance for certain unlawful dumping, creating a civil penalty for certain unlawful dumping, and providing for civil cost recovery for illegal dumping.
Second.
Then moved by Councilmember Powell and seconded by Councilmember Sauer to approve ordinance number 7911. Any further questions or discussion about the motion?
Mayor, I just wanted to comment that, this is a topic that we have been working towards so many years, and we've made progress and kind of had some steps back on issues as you identified. And, this is one of the areas where citizens did support us taking harsher steps You know, a lot of times they don't want government involvement as much as in this area. And especially those homeowners that where things are being dumped illegally in their alleys, you know, and they're not the ones putting it out there. And so I'm really, really encouraged, very excited to see this get implemented and see the impact, and very hopeful that it's going to address a problem that we have been working very hard to try and find solutions to.
Thank you. Okay, all of those in favor of the motion, please raise your hand. Any opposed? No? Okay. That passes with the 5-0 vote, and we will move on to item 3C, which is a public hearing and consideration of ordinance number 7906. Jared?
All right, Mayor, we've got Kyle Senior John, who's going to present the community investment program. We've talked about this in a previous work session, and this is going to be just a very brief re-presentation of that same information, and then answering your questions by council. Kyle?
All right, thank you very much, Jared, Mayor and Council. Pleasure to be with you today. As Jared mentioned, we're here to present the CIP plan. We've done our first public hearing previously in our last council meeting. This is the second public hearing of this document. This document is our investment strategy in capital and in capital projects for the city over the next 5 years. It is a program that we put together that gives us a guidance document to move these projects forward. And to continue to coordinate them through other departments and other things across the entire city, including citizen interaction and all of those things that come together to make this process successful, and do that on a repetitive basis. We've, again, talked about it a couple different times, but we had our first public hearing on January 26th, and then this is our second public hearing. Give the ample opportunity to hear from the public and answer any questions they may have. And then likewise, as this is a rolling plan, our departments have started some of those projects that are considered, I guess, year one type projects, and projects that are approved in our annual budget. Those are already underway. And then absolutely making planning and coordination efforts for those years 2 through 5 projects as well. Next week, in fact, we have our kickoff for our next year's capital plan, and start communicating with each other and across lots of department lines and other coordination issues, and start looking at what those next year's projects and next year's iteration of this process will be. The information is out there for the general public on our website. There actually is the link at the top of the page, but I said the simplest way to get to that is just on the city webpage and go to the departments tab there at the screen, the finance department. And then under finance, we have the financial information, which that page includes all of our annual budgets, as well as this top one right here, the draft 5-year community investment program, which after this approval, as you guys see fit, that will cycle off draft and be the formal approved document. I would be happy to answer any questions that you have, and any questions that the public may have in this public hearing.
Council, any questions for Kyle before we move to the public hearing?
The last fire station that we're fixing to be doing, the one that we had just approved purchasing that property, it wasn't a full fire station. I think it's part of one of the other support facilities. Where is that on your schedule? Kind of the start date and the completion. Is that on yours?
So that would have been one of the very last items that we did of Proposition 2. And I believe I'm scrolling through I'm going to share a different screen here real quick. That looks really funny. How about that? Is that better? This is actually the document straight off that web page I was just highlighting, and about midway through, about on page 20 is the actual standard list of those projects through the years 1 through 5. And if one of the things you'll notice is that all the Proposition 2 dollars were previously spent. These yellow highlighted projects right here are the last of the Proposition 1 projects, as denoted over here on the far right. And so those Proposition 2 dollars were a previous year's allocation, meaning that I don't necessarily have those dollars listed here in the book. Basically, they were already identified and put together. And I apologize, I don't know the exact schedule. Jerry and the facilities group operate and are doing those Proposition 2 projects, and so I can get you that schedule. I don't know it offhand. I apologize for that.
No, that's fine. I just didn't know if that fell under what you were presented. It was more of I'm hoping that's another short-term project that we'll see something kind of a quick turnaround. I didn't know where we were on the status, and that may fall, like you say, to Jerry or someone else to say just where we are in starting that and how long that project's going to take. And then, because that was one of the final things of that whole proposition, all those dollars.
Yes, ma'am.
Anybody else? Okay, at this time, we'll open a public hearing on item 3C, which is ordinance number 7906. If anyone wishes to speak for, on, or against this item, now is the time to contact the call host, and I'll hand it to Stephanie with instructions on how to do that.
Thank you, Mayor. If you joined us today to speak on this public hearing, please press *9 or the raise hand button. *9 from your telephone or the raise hand button from your Zoom app. Mayor, I do not see anybody that wishes to speak on this item.
Okay, thank you, Stephanie. We'll close the public hearing on item 3C and entertain a motion.
Yes, Mayor. I move to adopt ordinance number 7906, adopting the Amarillo Community Investment Program for the fiscal year 2020-2021 through 2024-2025, which will guide capital investment decisions for the next 5 years.
Okay.
Been moved by Councilmember Powell and seconded by Councilmember Smith to approve ordinance number 7906. Questions or discussion about the motion, Council? Okay. All of those in favor, please raise your hand. I see 4. Frida, oh, I see your hand now. I'm seeing it. Okay, I see 5 in favor. Good. That motion passes with the 5-0 vote.
Frida, your name sign is hiding your hand is what it is. I keep seeing it's like it kind of comes up right behind your title.
All these Zoom things. We now have all these Zoom skills. Like I told y'all before, you have little tells. Like I can tell when you're about to say something, and then I get your microphone turned off. It's actually in some ways easier than when we're sitting on the dais and we actually can't see each other because we're side by side. But hopefully all of that's coming to an end before too much longer, right? Okay. Item 3D is consideration of a resolution regarding Amarillo Health Facilities Corporation amended bylaws. Mr. City Manager.
Hi, Mayor. The Amarillo Health Facilities Corporation met on January 21st. They're recommending these amended bylaws to accurately reflect their current operating parameters. Laura Storrs is here to walk us through it. Laura?
Thank you, Jared. Council, this is one of your boards that actually only meets on an annual basis. They do not have a lot of current activity that is going on. And so we had our annual meeting with this board, and during the review of the bylaws, we noticed that there were some items that needed to be amended. The big changes that we've outlined in your packets are this board in the bylaws has just said was set at a 7-member board. And back in 2014, council made several revisions to a lot of the boards. And this was one of the boards that went down to a 3-member board because they don't have a lot of activity and a lot of need to meet at this point in time. And so we noticed that the bylaws had not been amended to reflect the change that council made several years ago. So this is kind of just clean up. So it's taking, the bylaws are being amended to go from a 7-member board down to a 3-member board. We also, as you can imagine, had to adjust the quorum down to a 2-member, 2 board members being present to establish a quorum. We also did some other minor cleanup. In the bylaws, it had stated that they would meet annually in the month of September. We've been having this group meet in about January or February, so we just removed the month that it stated they needed to meet in. And then a couple other small changes, changing the address of City Hall and changing the city commissioner and city commission reference to city council reference. So it shows you it's been a while since these have been amended. This group is there is state legislation in place that kind of outlines the requirements of this board. And that is one of the reasons that it must come to council in order for the bylaws to be amended. So again, this is one of your smallest boards with the least activity, and they only meet once a year, but we felt it was good to go ahead and get the bylaws amended and kind of cleaned up to match the direction that council has for this board. Are there any questions that I can answer from council on this?
Okay. And do we have a motion on this item?
Yes, Mayor, we do. I move to approve the resolution for the amendment to the Amarillo Health Facilities bylaws.
Second.
Moved by Councilmember Powell and seconded by Councilmember Smith to approve the resolution regarding Amarillo Health Facilities Corporation amended bylaws. Any discussion or questions about the motion? All those in favor, please raise your hand. Okay, I see 5-0. If you're watching online and you're curious, Councilmember Powell is voting with her hand raise option on the Zoom meeting. So again, I'm telling y'all, we are experts on Zoom here right at the very end. It's only taken us almost a year to get there. Okay, that brings us to the end of our action items on the non-consent agenda. We'll move to item 4, which is executive session, where we have several things, including some real estate considerations, some Amarillo economic development reports, and some HR issues on our annual performance review for the municipal judge and for the city manager. So because that section is a little longer than we typically have an executive session, council, let's take a bathroom break on our way over to executive session, and I will see y'all in that Zoom meeting. Thank you all for joining us today. Hope you have a good rest of the week.
Mayor, if I'll read the language real quick.
Oh, thank you, Brian. Yes,
no problem. Section 551.087, discuss commercial financial information received from existing business or business prospect where the city is negotiating for the location of a facility or for incentives the city is willing to extend, or financial information submitted by the same. Section 551.072, discuss the purchase, exchange, lease, sale, or value of real property. Public discussion of such would not be in the best interest of the city's bargaining position. Section 551.074, discuss employment evaluation of a public officer or official for the city of Amarillo. The time is now 3:54 p.m.
Thank you, Brian.
That